Welcome to the video on Effervescent Tablets. In this video, we are going to have information for the overview of Effervescent tablet formulations, how these are made, what is the motto for making the effervescent formulations. Effervescent formulations are available as tablets and granules. So these have some unique properties, and these are the formulations which can contain large amount of the dosage. Let's start with the introduction. Effervescent tablets are uncoated tablets, and these tablets are designed to dissolve or disperse in the water before administration. That means these tablets are not to be swallowed. These tablets are added to water, and then these are dispersed with effervescence, and then that solution or dispersion is taken by oral route. The tablet intended to be dissolved in water before use, releasing the carbon dioxide. So you might have come across this type of formulations. When you add this formulation to water, then you will see the gas bubbles are evolved and the tablet get disintegrated. If the tablet contains all the soluble materials, then you will get the solution, clear solution. Or if it contains some insoluble materials, then you can see the dispersion. Effervescent formulations like tablets and granules contains acid substances and carbonates, bicarbonates that react in water, releasing the carbon dioxide. Various type of actives can be formulated into effervescent formulations. Out of those, some are the drugs difficult to digest. These drugs suitable for drugs that are hard on stomach, pH sensitive drugs, includes amino acid, antibiotics. Drug requiring large doses. Effervescent tablets can handle larger dosage of active ingredients. This is the main advantage. Common treatments using effervescent tablets. So many APIs are formulated which belong to the category of arthritis and pain management, ulcers and gastrointestinal issues, allergies, osteoporosis. Many of the time, the APIs which are used for throat infections and mucolytics can be formulated into effervescent formulations. So these formulations have some advantages, like the drug is available in solution form, and then that solution is administered by the oral route. So many of the times the formulations like for the treatment of osteoporosis treat bone conditions with improved bioavailability. Other different advantages are also there. Drugs and formulations for effervescent tablets. Aspirin is a common painkiller, and you might have come across this effervescent formulation. Then paracetamol is there, ibuprofen, antacids are formulated. Then ascorbic acid, vitamin C supplements, acetylcysteine, which is an antidote for paracetamol overdose, and it is a mucolytic agent. Then activated charcoal. These are the common drugs for formulations for effervescent tablets. Now see the advantages of effervescent tablets. Fast onset of action. This is because rapid absorption due to dissolution in water. Easy to swallow. No need to swallow large pills or large tablets. Stomach has intestinal tolerance. Gentle on the GI tract. Improved palatability. More enjoyable to consume. superior stability, longer shelf life, accurate dosing, precise amount of active ingredients can be administered, improved therapeutic effect. So this is by the enhanced absorption. Preparation of effervescent tablets. These contain mainly the active ingredients which have the therapeutic benefit. Acid source like citric acid, tartaric acid and some others. Alkaline compounds, carbonates or bicarbonates like sodium bicarbonate. So as per my experience, mainly the citric acid and sodium bicarbonate are used to get the effervescence. Acid sources are like citric acid, tartaric acid, ascorbic acid, acid anhydrides, citric anhydride, succinic anhydride, acid salt, sodium dihydrogen phosphate, disodium pyrophosphate. Carbonate source are sodium bicarbonate, which is most widely used. Sodium carbonate is less commonly used, but it is effective also. Potassium bicarbonate used in some formulations. Calcium carbonate found in some nutritional tablets. Calcium carbonate also acts as a source of calcium. Generally, sodium bicarbonate and citric acid are used. Formulation of the effervescent tablet require some raw materials like diluents, binders, disintegrants, lubricants, sweeteners and flavors. So as the formulation is required to be dissolved in water or dispersed in water, so some flavors and sweeteners are used so that the solution can be consumed easily and it is to be palatable. Different diluents can be used like mannitol, lactose, binders like PVP, maltitol, disintegrant like dextrose, sucrose can be used. Sometimes crosspoidone can also be used. Lubricants like stearic acid is there and others like sodium stearyl fumarate. Then sweeteners like sucrose, xylitol, sorbitol are there and flavors. Generally the raw materials are soluble in nature because if these are insoluble then it will make a dispersion. Also the mouthfeel for swallowing the solution will not be good. Manufacturing and evaluation of effervescent tablets. So generally dry granulation and wet granulation methods are used. Wet granulation is done by top spray or by RMG, which can be with or without heat. Sometimes melting of the ingredients or fusion method is used for granulation. Dry granulation can be done by slugging or direct compression. Evaluation parameters or quality control parameters for effervescent tablets are description, average weight, effervescent time, which is generally 5 minutes, assay related substances, then average weight and weight variation, content uniformity, and other parameters like assay of the assay of the preservatives if preservatives are used, and assay of the stabilizers if stabilizers are used. So depending on to the formulation, these evaluation parameters are there. Effervescence time is the main parameter for effervescent tablets and it is not more than 5 minutes. So generally with effervescent tablets you will get effervescent time of around 1 to 3 minutes. Effervescent time also depend on to the formulation and the tablet weight. According to ESP, the effervescent time of an oral solution effervescent tablet is 5 minutes or as specified in the individual monograph. The criteria for effervescent tablets are gas bubbles are produced in large numbers. The gas around each tablet or its fragment stops evolving after 5 minutes. The tablet has dissolved or disintegrated and is dispersed in the water. So these are the main points for the effervescent tablets testing for the effervescent time. Whenever you are working on to the effervescent formulations, always protect these tablets and the raw materials from moisture. Carry out the manufacturing operations in low RH areas. For measuring the effervescent time, 200 ml of water is used, and 200 ml of water is filled in 6 number of beakers, and 6 tablets are required to be tested for effervescent time. General criteria for effervescent time is not more than 5 minutes. So this is the information regarding effervescent tablet formulations. Similarly, effervescent granules are also formulated, and these are filled in the sachets. So this is the information for effervescent formulation. Thank you for watching the video, and I hope you might have got idea regarding this formulation.